Hi, and welcome to the Sexual Health Alliance Problem Sexual Behavior Certification Training Question and Answer session. My name is Heather McPherson, and I'm going to be moderating this question and answer session by the questions that you guys sent in via Gmail and on our socials. So we will get started here in a second. There were a lot of questions that came in. We're going to do our best to answer as many as possible. If you have a question that didn't get answered during this time, please feel free to email us or shoot us a message anywhere on any platform. We'll make sure to get back with you. So I'm going to pass it to David to introduce himself.
Actually, I'm going to ask Michael to introduce himself first.
No.
Absolutely.
I was gonna go by your structure. Let's see. I'm Michael Vigorito. I'm a licensed marriage planning therapist, private practice in DC, where I primarily work with men concerned about sexual behavior problems and out of control sexual behavior, both in individual and group. I'm also a consultant working with University of Maryland's Prevention Research Center, where we are training behavioral health providers to integrate LGBTQ affirmative practices, as well as facilitating sexual health conversations with their clients.
And Michael, as always, is too modest. Michael is also the co-author of Treating Out of Control Sexual Behavior, Rethinking Sexual Addiction, which is an incredibly influential book in this whole dialogue. I couldn't think of a better person to do this training with than Michael, who is part of the process where we are changing the dialogue about how to work with people who are struggling with their sexuality. I'm David Ley. I'm a psychologist, author of The Myth of Sex Addiction, and basically a longtime gadfly in this dialogue. For years, I've been asked, okay, David, if you don't believe in sex addiction, then what do you believe in? What are the appropriate treatment modalities to use with people who come to us who are struggling with their sexuality? So after 10 years of that question being asked, I got tired and finally gave in and said, okay, let's do it. With the Sexual Health Alliance and with Michael Vigorito, we embarked on this journey, and we really invite you guys to join us in this journey in figuring out what are the right strategies. In the question and answer period today, we want to wrestle with the questions that you guys are asking about where does this go, but I want to say, first and foremost, that the goal of the Problem Sexual Behavior Certification is not to teach you to know the right answer. Instead, it's to teach you to ask the right questions. We want to invite you to be curious. And I want to be clear, I learned that from Michael. Being curious about our patients' experiences, being curious about the things that they bring to the table that they are struggling with sexually, is how we learn to help them. Going through this program, going through problem sexual behavior training is not about knowing the answer. It's about knowing that our job is to connect with this person overall, to be curious about how things work for them, and then to explore ways that those connections happen. I'm looking forward to all the questions. I'm looking forward to this training because I'm really excited to learn from our participants, to learn from Michael, to learn from Heather. That's how we all move forward in this together. And that ultimately is the thing that I've struggled with for years, in whether it's sex addiction or compulsive sexual behavior, whatever damn label we want to wrestle with here. I'm tired of people who think they have all the answers when all I've got is questions. I want to explore those questions with you together. Heather, I think we've got a bunch of questions today.
Yeah, I mean, I want to reiterate that. I think you said and learn from me, and I was like, no, no, not learn from me, because you guys are the people that I've been learning from for the last decade, and you guys have a wealth of knowledge, and I think that obviously the collective group will also bring a wealth of knowledge to this program. So we're really excited about it. Some of the questions to start with were just logistical questions. So this program is a gentler, more holistic, and evidence-based alternative to becoming a sex addiction professional. We include all therapists and sex therapists interested in helping people who are concerned about sexual behavior problems or identify as sexually addicted or compulsive. If you are not already in our certification program, just shoot us an email, let us know who you are, and we'll get you registered right away. We just want to meet first with you and make sure that you're going to be a good fit for the program, not meet physically or online, just through email, and just see who you are and invite you to join the program. If you're a general therapist or maybe even not a therapist, maybe you're a coach or educator, but you really want to learn this information, that's where we ask you to just email us and let us know who you are and what you're interested in, and then we'll invite you to join the program.
And I want to be clear, this program is not about reprogramming or arguing or debating about whether sex addiction is real or not, whether that's the right answer or not. I think we're at the point where we want to move beyond that. We want to explore how can you as a professional help the people that are coming to you seeking help. And labels don't help anybody. We want to help you, again, to be curious and ask the right questions.
And that brings us to our next question. How is this different from a traditional sex addiction treatment training program?
Michael, I'd love to hear your answer to that.
Well, thank you. Well, I would piggybacking on what David was saying. One of the things I was excited about this program was this is not just going to be about how David treats this issue or about how I treat this issue. We are hoping to elevate all of the experts that we have come across in the field to talk about their particular areas. So we're excited about providing a platform for a variety of voices. So that I think that speaks to the difference between what we're trying to do and the sex addiction treatment certification program, right? It's not just one singular overriding definition of what's been going on with this client. It's not a specific task-oriented approach. We want to be able to help the students think critically about the issues that are presenting to them. When someone is coming in saying that I feel like I'm a sex addict, or I think I'm being compulsive, or I feel out of control, we want to give you the tools to think critically about what is going on, to evaluate the narratives that the clients have, and then to be able to develop a treatment plan that's going to best help them achieve their goals, their vision of sexual health, what they're trying to achieve through therapy.
Yeah, if I had my way, the certificates would say that you're now certified in critical thinking about sexual behavior problems. One of the big problems I've had with, all of the sexual behavior programs and approaches before are that they are incredibly personality driven. Guru driven is also a term. And this is not the David Ley model. This is not the Michael Vigorito model. It's not the Heather McPherson model. It is the evidence-based best practice model at this moment. And I think that's incredibly valuable, because unfortunately, I think that the past models have failed on the fact that each of them is driven by a cult of personality who want to be right. Michael and I don't want to be right. We want to help the people that are coming to us seeking support. And my right answer today might change tomorrow if more research comes out that says, hey, the idea I had yesterday was wrong. I'm willing to change on that, and Michael is too. We want to help you think critically about these questions so that you can make those decisions yourself. The goal of this program, I think, is to invite our participants to acknowledge that one size does not fit all, and that there are folks who come for treatment where this model is not appropriate, but this model is, this strategy is effective, and this model isn't. The OCSB model, I'm a huge fan. But as Michael knows, I think that from the beginning, I've said, well, but there are these folks that I think are missing. How do we support those folks? Whether it's individuals that are experiencing moral incongruence and religious conflict, folks where group therapy isn't appropriate. All of those issues are I think, the goals that, or the strategies, the questions that we want to invite folks to wrestle with. There is so much controversy about all of these issues at a public level, that we want participants to be able to go into those dialogues recognizing that one definition, one explanation, one treatment isn't right for the complexity of the issues that people experience around these problems. So we as clinicians have to be equally sophisticated.
And I would also want to add something that David mentioned earlier around some of the kind of guru specific or guru centered approaches that are also out there, that I did not want to create a certification program in out of control sexual behavior or Michael Vigorito's out of control sexual behavior model. To me, would be too idiosyncratic and would put me at the center of that, which I do not want. I like to take the approach of, I'm here to share how I think about this and how I work, and how now I want to share how other people think and how other people work in this issue. So I think you'll see some differences between what I talked about in that October training and what we're putting together for the certification program.
Well said. Thank you to you both. The other question centered around, we will be meeting monthly live. What will those meetings look like, and what happens if the student misses them?
In those monthly meetings, we're going to be having basically some more live discussion. The goal of those monthly meetings is that, Michael and I are going to be presenting some additional kind of follow-up information to the webinar and the topic at hand. But then we're also going to be engaging in some live discussion of those issues with participants, up to and including some actual case discussion, whether it is cases that I've worked with, Michael's worked with, or folks that are in the group presenting them. So the goal is to take that information and now integrate it in a more active kind of live kind of model. If you can't participate, if you can't make it that day, that's okay. You will be able to watch that video and engage with that material as we go. You're not going to miss out. You're not going to be left behind. And then the next session, hopefully, if you have questions that are lingering, you're going to be able to engage with us. Again, what we're trying to develop here is a community, a dialogue, a relationship, and an engagement around how we all work together with these issues. So if you have a question after that session that you didn't get to ask, Michael and I are not going to ignore you if you send us an email and say, well, what about? We're going to talk to you, because we want you to be the most effective clinician that you can be, supporting the folks that are struggling with these issues. That's how we think we make all of this better.
So the next question is, what if I'm a beginner, or what if I'm seasoned and I've been in the field for over a decade? Can I still take this program, and what kind of information will I be able to apply from this program?
Well, I think that's what I like about the flexibility of those in-person meetings, because we can help address folks depending on their developmental level and experience in the field. So we're hoping to create a space that's flexible enough for us to be able to meet people where they are, their level of skill and experience, and help bridge some of this information to the work they're already doing.
Yeah, and I'm going to be I'll be honest. I'm a beginner every time I meet a new patient, because I'm a beginner in terms of trying to understand them, the issues that are going on in their life, trying to figure out how to connect with them and to develop the interventions that are going to be effective. As Michael said, I mean, the guru kind of model is based on this strategy of, I know the answer. I can look inside your brain. I can look inside your life, and I can tell you what you need to do. But I've never been that confident. And I don't think it helps for us to be confident. Instead, that curiosity comes from approaching every therapeutic relationship as a beginner, and how do I learn about how to help you. So I don't think it matters whether you're a beginner or seasoned, if you can engage with us in developing that curiosity. Okay, so I'm going to take it back. I want to give people a certification in curiosity around this, because more and more, I think that Michael frames it so well when he says that's what makes a difference as we work with patients.
Absolutely. So the next question is kind of centered just around, what does all of this include? We have an online platform. It's a learning platform. It's specialized and pace accessible. So you do it at your own pace. You go through the modules at your own pace. And there's lots of research and articles and assignments and case studies in there. And then we also have monthly special topic recorded webinars with expert guests, plus interviews from the field. And I have to say, we have some absolutely incredible special guests and incredible interviews. I mean, these are all from the people that are at the top of their game, top of the world in terms of this specific topic. So can you guys just kind of explain a little bit about those special guests and those interviews that we have done? Because I'm really excited about that too, because it's not just, David and Michael, which are incredible and they're leading this program, but we have also just so many people contributing to it in a meaningful and powerful way that I want to acknowledge.
The goal, again, is to teach you to think critically, and that involves being able and willing to explore where the field is going and where new research is happening. In addition to that, Heather's right. I mean, we're bringing in rock stars, whether it's Josh Grubbs, Nikki Prowse, Charles Samanow, Shane Krause, Cameron Staley. I mean, the level of thought and experience that you're going to experience here is second to none. I've been in this for a little while, and I can tell you that nowhere are you going to be exposed to as many potential thought leaders as in this program, who are intending to not teach you to think like them, but to teach you to think critically about where this is going. That, I think, is the absolute unique thing about this program.
So the program includes 125 ASEC CEs, and you can either pay all in one lump sum, one-time payment, or you can have it spread out. And then in each of those options, you can include ASEC CEs or without ASEC CEs. So know that even if you make a payment, one-time payment or a payment plan without ASEC CEs, you'll still get access to everything else. You'll have everything else included except ASEC CEs into your program. And that's because there's plenty of professionals that don't need ASECs, maybe they don't want to get certified, or maybe they have too many. I know our students get more than enough and you don't need them until you renew years later. And so we wanted to give that price flexibility and tuition flexibility so that you can choose what works best for you.
And regardless of CEs and credits, I know that stuff's important. God knows I have to keep track of it myself. But over the past few years, I mean, I've really just been honored by the fact that folks that have been trained in other models reach out to me and say, you know, I'd like to hear some other ways to approach these issues. And as clinicians, I think we all need to be moving forward. And this is part of moving forward. As society is moving forward with attitudes towards sexuality and sexual diversity, we as clinicians need to move forward too. This is your opportunity to do that.
Another question that we've gotten is the at your own pace question, right? Have monthly lives with both of you, as well as recorded webinars that will be dropped live every month that you can watch later. You can also watch the monthly lives that we record with you guys later. And then everything in the modules will also be at your own pace. You can do it whenever you want. You can do it in baby chunks and big chunks. You can do it all within a couple of months, or you can do it all at the very end of the program. We recommend obviously doing it a little bit of chunk at a time. That's why we're dropping the lives and some of the modules as we go. And at the end, we will give you a couple of months to finish out the program. If you get behind, we know that sometimes that happens, life happens. So if you get behind, you'll have a little bit of time to catch up. So don't worry about that. You can always email us and ask us for an extension too. We've done that with some of our other specialized certification programs. So please just know that we'll work with you, but we do want to make it accessible to you. We do want to make it in bite-sized chunks so that you don't feel overwhelmed each month. And typically that's worked really well.
Yeah, we know there are different kinds of learners. And if your goal is to figure out how to integrate this material into the work that you do with people, we're going to work with you. We have the same goal.
Absolutely. Any other last words of this Q&A, maybe questions that you've gotten or anything else that you want to say?
I mean, the primary thing I want to say is how excited I am about this program, that I'm looking forward to meeting professionals who are interested in kind of an expansive view on this issue. I mean, I find the people who are interested in this topic to be fun and are, I think, what am I trying to say? I was going to use the word brave, but I don't know if that's too hyperbolic, but because I still think talking about sex is challenging, and people need some courage to be able to do that with their clients. They might not have gotten the preparation or education in their formal education. It's still something that's stigmatized. Therapists aren't necessarily comfortable about this. So to acknowledge that this is a growing edge and then taking action to correct that or to expand in that area, I think is something to be excited about. And I usually have a great time with those folks. So I am super, super excited about meeting you all and spending the year with you.
Yeah, like Michael, I'm excited about learning from you. I'm excited about hearing the issues that are not being captured currently, so that we can think critically together about how to help people develop healthy ways to approach these issues, with us saying it's not about what you do, it's about how you do it. How can we help therapists to teach their patients or work with their patients to figure out how to integrate sexuality in a healthy way? Not just today, but tomorrow and in 10 years and in 20 years. That's the work I'm really excited about being part of.
I'll say two more things about this program and then we'll wrap it up. One is that this program, I'm so excited for how many different perspectives that we have. And that also comes with how many different models, treatment models, programs that we're incorporating into this training program, because there isn't just one model. There's a lot of different perspectives in terms of how to treat problem sexual behavior, and to hear a diversity of voices and perspectives in this common issue that we as clinicians and all different types of professionals face is so critical. And so I'm really excited to hear all of those different perspectives and seeing what will fit with certain clients that I might have. And then the other thing I wanted to say is that, no matter where you are in the world, know that you belong to this program. With the Sexual Health Alliance, we've had students from all over, including Australia, Japan, Germany, UK, Norway, India. We've had people all over in all of our different certification programs. So please know that even if you're in some tiny country on the whole other side of the world, that's why it's all online. That's why it's all recorded. You can watch it anytime. You can go at your own pace. We wanted it to be accessible to everyone. So we welcome you with the Sexual Health Alliance Problem Sexual Behavior Certification Training Program. Thank you so much. Yeah, thank you so much to both of you for being here and answering some of these questions. And if you have any more questions that you didn't get answered, please email us at shawcertifications@gmail.com or through the website sexualhealthalliance.com.
Thank you, Heather.